gotten your contact information. So if you want to drop who you are and where you're tuning in from in the chat, and let us know what you're doing and how we might be able to use you as a resource. Okay, Randy, why don't you go ahead and introduce yourself, let everybody know who you are, and get us started.
Okay, I can do that. I can kick things off. My name is Randy. I am a customer success consultant with Chess Health. I'm sure quite a few of you have encountered me in these meetings in the past, speaking on our Connections app platform across the state of West Virginia. If you haven't learned about that, I'm happy to talk to you one-on-one about that platform. Today, I'm here to talk about a brand new resource that we have to share in West Virginia, and that is our companion app. See if I'm gonna be able to share. Yeah, all good. I'm gonna share my screen, just have a couple slides to educate you on this new platform. So the companion app is designed to be a resource for anyone who is in the support system of an individual with substance use disorder. So mom, dad, brother, sister, husband, wife, children, neighbors, really anyone who's connected to substance use that wants more resources, that needs more education, that needs support. This app mirrors a lot of the functionality of the Connections app. There is a community forum where people can discuss topics, ask questions, share experiences. There's a content library full of local West Virginia resources, full of national resources, Al-Anon, Nar-Anon, things like that. But then, treatment locators, resources for food pantries, clothing closets, educational materials to learn more about substance use. So really a platform that can give individuals a better understanding. There's some surveys that are built in currently that look at how people's relationships with their family members in recovery or their loved ones in recovery, how those are changing over time. Motivational quotes, things like that. There's resource meeting, or there's recovery meetings in the app, live through the app. So kind of like an Al-Anon or Nar-Anon meeting in the app. And then the ability to message with other participants, message with our peers to ask questions. In depth, I'm going to send this PowerPoint out. So just kind of some in-depth on some of the features. One thing I do want to point out, though, in terms of connecting individuals through this app, if you see in the top right corner of the screen where it says parent there, as a person signs up for this, they're going to identify their relationship with that individual in recovery or still in active addiction. So it says parent. This could be a parent of a child with substance use disorder who's in long-term recovery. This could be a parent of a child who's passed away from an overdose. This could be a parent of a child with a mental health diagnosis, and they're still very young, they're still very new, so they don't really know what to do, and they're going to be able to interact and identify each other through the app, through that kind of badge. And then you know where to turn for resources. I do want to stress that this is also an anonymous platform like Connection, so individuals don't have to share their names if they don't want to. They're able to get the resources they need in privacy, and then be able to take them home with them. So pretty simple platform, pretty simple structure, but I know these resources are lacking just across the board. So if you know anybody that needs this, that would want this, feel free to share it with them. I'm going to send over an enrollment link to get them onboarded. When they click the link, it goes to this web form, which is an invitation to sign up for the app. We just take a minimal amount of information. They're sent text messages, one with a link to download the app, one with the temporary password. They sign in using their phone number and that temporary password, and then they can use all the features in the app. So super simple process to get signed in. And then they have access to the library and the community. Does anybody have any questions about the app, about how it works, what the purpose is?
Is this app free?
Yes, it is absolutely free.
Okay.
Yep, it's paid for through a SOAR grant. WVU Health Affairs kind of manages our grant. And this actually was developed by, paid for by the state of West Virginia to share across the country. So we're definitely leaders in getting this established and rolled out.
And anybody can use it.
Correct. Anybody can use this.
Okay.
And the link I'm going to send, it's to what we call the public version of the app. So it kind of just pulls everybody into one bucket and they can communicate with each other. If your agency has a family program and it would be important for you to be able to interact with these individuals, give them one-on-one support personally through the app, message with them, see how many people are involved, we can get you set up with what we call the dashboard, and you can offer it in a more one-to-one personal manner. So if you want to do it that way, let me know, and we can kind of get you set up formally with it versus just here's a resource to share. Appreciate the comments in the chat for sure. If there's nothing else, I have finished. So whoever needs to go next may go next.
Well, thank you. That's really helpful. And we'll probably send you an email just to get like I don't know if you have literature or anything like that.
We have a couple pieces of information. This is so new. Our formal marketing materials aren't available yet, but I can, the slides that you have, just a quick blurb about it. But yeah, we're gonna get posters and things in the next day or so.
Okay.
And I have, his presentation and the link and everything, so I'll send out to everyone after the meeting.
Okay, perfect. All right. Well, next up we have Chastity Robinson. She is going to talk to us a little bit about post-incarceration syndrome and the work that they're doing to bring awareness and how you guys can use them as a resource.
Hello, good morning, everybody. I was trying to pull up my slides and it ain't working, so just bear with me. So my name is Chastity Robinson, and the name of my organization is SOAR 4031 Foundation. And so our main goal is to focus on the mental health of people who are coming home from incarceration, as well as their families or support systems. And what we raise awareness about is post-incarceration syndrome. We are doing a research study and have been for the last 4 years with the University of Cincinnati School of Medicine around post-incarceration syndrome and the effects that the trauma has on people who have gone through the incarceration process or supported someone through the incarceration process. So the idea is one, we want to get it ruled as a real disorder, because 100% of people that are coming home from prison are coming home with mental health issues. Okay, 100% of them are being misdiagnosed because PICS is not yet ruled a disorder. Everyone is only being diagnosed with one of the 5 symptoms, which is PTSD. And so what we do is we raise awareness about what PICS is, and we go around to different colleges and universities to get them to adopt the research, so that we are inadvertently training folks who are in the mental health space, like psychology, sociology, not sociology, psychology, social work, school of social work, or if they're going into law or anything like that. So they will be studying our subjects that come in and take the survey that we have for the research, and they are learning and studying about people. So when they go to their respective places of professionalism, they will already be aware of what PICS is. And that's one way that we are choosing to advocate. Another way that we are advocating is through reentry programs. And so we are asking those in the reentry space to, as their clients are coming in, that they take our research study survey. And then once they take the survey, we are able to create communication plans through that, because we're able to understand what their triggers are and help them identify with what they are. And with that communication plan, it is for them, and it is also for their support system. So when we create this communication plan, what it will do is it will allow people who they are directly in contact with, whether it's their parole officer, probation officer, their employer, their support system, they will be able, or their therapist, they will be able to take this supporting document to these people so that they can better understand how to relate to them, and how to pretty much treat them, and understand that the things that they're dealing with and going through is because they're not haven't and can't adjust to freedom properly, because their mental health is not healthy. And so through this, we have also created a 12-week cumulative program that we are launching in February of 2025. So everybody that comes through and they take the survey, that we connect with, whether they are family members, support system, or they have been formerly incarcerated, this 12-week program will be available to them. In this 12-week program, the first 6 weeks, all we talk about is PICS, what it is, how to identify with it, and how to help them identify with their triggers and deal with their trauma. The next 6 weeks is we do financial planning, holistic healing, different things to help them be sustainable once they exit the program. And the great thing about this is this 12-week program is going to either, our first goal is to reduce recidivism rates, and then our next goal is to eliminate them all the way together. We are given the piece to reentry that is really not talked about a whole lot. And so through this 12-week program, we dive in and divulge into things that people who are going through this typically wouldn't talk about, and they're able to talk about, deal with, and identify. We also offer case management and therapy nationwide. So this is not just, I'm based in Ohio, but this is a national effort across the country. So that's what we do. That's who we are. And we have been very successful in the last 4 years, just developing different things as we go along. And we're learning more about people and how to educate people about post-incarceration syndrome. And our website is, and I'll put it in the chat, if you want to learn more about us and our program, is PICS, PICS, real, REAL.org.
Can you talk about what PICS is for people that might not know what PICS is?
Yeah, so with PICS, there is, here, let me share my screen really quick. Give me 1 second. Let me pull this up. 1 second.
And if y'all see me over here clapping, it's because there's this gnat that keeps flying past my face and I can't catch it. So
All right, I'm going to share my screen really quick. Let me find y'all again. Oh, shoot. Where did it go? Where did y'all go? Okay, here you are. Let me share my screen real quick. Okay, it's not going to let me do it. Okay, so I'll just explain it to you. So there are 5 symptoms of post-incarceration syndrome. The first is institutionalized personality traits, PTSD, of course, antisocial personality traits, social sensory deprivation syndrome, and reactive substance use disorders. And so what are all these things, Chastity? What are you saying? Well, pretty much when people go to prison, they are stripped of all these things, right? And so either they gain several different personality traits because of how they have to adapt to different scenario situations that occur in incarceration because of the isolation. And then the antisocial personality traits is exactly what it is. People become antisocial because they lose that lack of autonomy. They lose the lack of interaction. Only what they know is what they have learned in the setting that they have been in. So when they are reintegrating back into society, then all those skills that they have lost since they've been incarcerated, they don't have them anymore. So that's like if you lift weights and you are a weightlifter and you go every single day, then what happens? Your muscles get strong. You get muscles. But if you do not work those muscles and you don't use them, then you lose them. And so that's what this is all these traits and being able to identify with human interaction. Just human interaction by itself is one of the main causes to post-incarceration syndrome, because when that person comes home, they do not know how to interact with people, places, things, because these things have been taken away from them. They get overwhelmed with freedom, not even society, because we haven't even made it to that part yet. Because what we fail to realize is that if a person has been in prison for 5 to 10 years, and they have been used to a uniform way of living for those 5 to 10 years, they have seen things that we cannot even imagine. They've been through things we can't even imagine, and they are used to this way of living. Then they're released, and all of a sudden, in a matter of moments, their life has changed. So that drastic change can throw them either into substance abuse use disorder, or it could throw them into a psychological tailspin, and they will do something, anything, to get back to what they know. And so a lot of times we see that, and we might have that family member, might have that friend that talks about that one family member that every time they get out, they go back. It's because they have this approach to life as I can go back to what I know and it's comfortable, as opposed to trying to learn all these things that I have been taken away from for all these years. I had a gentleman tell me, he was like, Chastity, you don't understand. In prison, I just have to learn how to stay alive, learn how to feed myself, and talk to my family every day. I only have 3 things I have to do. But when I come out here, the buses are going, the cars are moving, the trains are whistling, like people are moving. And I don't know how to adjust to that. And that's what this is. We teach people about it. We help them identify and have coping mechanisms so that when they do go for that job interview, they do go to that place of employment, they are able to mentally sustain themselves and be able to adjust to those things. Because we can't expect people to, do simple things as to get on a bus, right? Get out, go to a halfway house and get on the bus. Well, how am I supposed to do that? I don't know how to do that. And shame comes with that because they're grown adults that have no idea on how to do the simplest things in life. And so through this research, through this program, that's the part that we tackle and that we help develop in people. Was that good enough, Morgan?
Yeah.
I was just saying,
If
I
somebody
think-
wants to like get it. Oh, go ahead, Krisha.
Yeah, I was gonna say, I think all that, I mean, it's fantastic. I mean, they make 100 choices a day while they're incarcerated. Do I get up or do I lay in bed? Do I get dressed? Do I take a shower now when it's offered to me, or do I not later? You know, when they come out, we want to take them out and let them experience all of these things, but it's so incredibly overwhelming and overtaxing to their mentality. You know, oh, I want to take you to my favorite restaurant. They are not used to being in a public setting like that.
And they don't want to.
No, a menu is incredibly overwhelming to make a choice from, because you don't get a choice of what you're going to eat. You're getting a choice of, do you eat or not? You know, where they're sitting in location to the room, all of the noises that are going around, you know, just little things that we take for granted are incredibly overstimulating and overwhelming to someone as they come out. So I dropped over in the chat like one of my favorite scenes from Shawshank, you know, when Red goes up and sees the parole, and they're like, well, sir, are you rehabilitated? And he's like, sir, I don't know what that means. And he's like, well, it means, are you ready to go back out into society? And he's like, well, I know what it means, but you don't know what it means from my point of view. So yeah. So
Exactly. What you're saying is, and that's something that we talk about. We prepare families a year before their loved one comes home. That's the important part, because when my partner returned home, it was the small things that overwhelmed me, right? So he would take baths in the sink, and I'm like, what are you doing? Like, that is so abnormal. Like, why are you doing that? And I would get frustrated because he wouldn't stop doing it. And then he finally said, this is all I had for 9 years. And then it made me think, like, you know, and when he finally did take a shower, he broke the handle. And I'm like, and I freaked out again. I'm like, it's just simple. You just pull it up. And he was like, Chastity, I've been pushing a button for 9 years. So the small things is what we take totally for granted, that you wouldn't even think that it would be simple, because what we see is, we see that person, we see an adult, we see visually someone that we feel like, you should know these things, but they don't. It's like raising a child all over again. From the side of family members, like, it's hard for us to cope too, because we have assimilated a lot of characteristics by being on that phone and supporting that person, right? We have done the isolation. We like, for me, for instance, I don't like the sound of a phone ringing, and I keep my phone on silent. I don't put earbuds in my ears, because I did for 9 years. You know what I mean? I don't like going through metal detectors, because it reminds me of a visit. Like, it physically makes me sick. And so as family members or the support system, we deal with pigs too, you know? And so just helping folks to identify with that and understand that this feeling is exactly what you're dealing with. You would be like, people, when they take this survey, they're like, oh my gosh, this is it. This is what I'm dealing with. This is what I'm going through. I have to tell my therapist. I have to tell my social worker. This is what I'm dealing with. And so just helping people just identify with the small things, because they have expectations. They got to get a job. They got to get housing. And that's hard enough. But nobody is talking about how they mentally can consume that, you know, to be able to do that. And so that's the part that we are taking on, is how we can help them mentally consume freedom and all the adjustments to be able to do them and be sustainable.
If an organization wants to like use your survey and refer people to you, how do they do that? How do they go about doing that?
Yeah, so we have a letter that we send out to everybody if you're interested. And then in that letter, there's a link that you can share out to anybody that wants to take the survey. It is virtual. I mean, it's online, so they can take it. It only takes about 5 to 7 minutes for them to take it. And then once they take it, then we will schedule them for the phone interview part of it, because this is a quantitative and a qualitative study. So it's in 2 parts. And then once they do that, and we get all their data back, then we are able from that data to be able to give them, one, identify which level of picks that they have, because everybody's isn't the same. And then 2, we'll be able to create that communication plan. So if they have a support system and you know it, ideally would like for everybody in the household to take it as long as they have supported their loved one, as well as the person who just came home. That way that we can help the whole entire unit as a whole. Yeah.
And anybody can utilize your all services, right? Like family members, people that are, but it doesn't matter where they're at.
It doesn't matter what at all. It doesn't matter where they're at because this is a nationwide survey. It is a nationwide. It's a national effort. So anybody anywhere can be a part.
Does anybody else have any questions, comments, concerns, things that you would like to add? Okay, don't everybody jump at once.
I think I might have just covered it all.
You did such a good job.
I can talk about this all day long. I talk about it in my sleep because it's really important. It's really important work. We really would like to come and get established in West Virginia solely because we know the resources are limited there, especially when it comes to formerly incarcerated people and what that looks like. And so we really would like to get established in West Virginia to offer more support and help in that area. I'm a West Virginia girl, born and raised in Mingo County. So I do know that it would be very necessary back home in the area. And so that is one of my goals, is to get established and set up a space in West Virginia and a central location for folks to be able to utilize.
Well, if you'll definitely put your contact information in the chat, I'll briefly, when we do introductions and stuff, I'll let you know what all, we do, but that we are reentry in West Virginia, the reach is, so. And that whenever you're ready, so.
I'll tell you a quick funny story about how small West Virginia is, because I facilitate national healing to advocacy cohorts for SE Justice Group, which is a group for women with incarcerated loved ones and formerly incarcerated women. And so I got this referral for this girl, and I'm the only person from West Virginia that I knew in this group that's based out of California. So on my list of people to call for my cohort, Chastity's name comes up. So I call and she's like, I thought this was my mom calling. And I'm like, why would you think this is your mom calling? I have a West Virginia phone number. And I'm calling to tell her that she's been accepted into our cohort and that we're going to start, and all the great things about the cohort that I'm getting ready to send her through. And she says, I'm from West Virginia, which was really weird because there's thousands of people in this organization. I'm the only one from West Virginia. And she starts talking to me. She's like, I'm from Mingo County. And so she's just been stuck with me ever since then, because we're the only two West Virginia girls in this cohort. So it was really funny. She's like, I thought you were my mom. I'm like, why would you think I was your mom calling? She's like, I'm from West Virginia. I'm like, really? She's been my partner in justice since then. We can go through and do introductions now if everybody wants to introduce themselves and tell everybody what you do, or just chime in. I'm Morgan. Probably most of you know me, but if you don't, I work for the Public Defender's Office out of Jackson County. I also facilitate healing to advocacy cohorts for SE Justice Group and wear about 85 other hats. So if you need something, just call me. I probably have a person, or I can do it myself. Anybody else can just chime in, or I can popcorn it, or I can just tell you, Krisha can go.
All right. So all of you guys know me, but I'm Krisha Spears from the Reach Initiative. Chastity, we are the Restore, Empower, Attain Connections Through Hope. We are pretty much everything for reentry in West Virginia. So we do a navigator program. So we pair up people that are with lived experience that have successfully navigated those barriers, and we make them a mentor for someone who is coming out. So they walk together for about a year just to help them, how to navigate those barriers of, okay, I'm out and I need to get a phone. I've got a phone. When do they come into my house to hook it up? Yeah, it's already hooked up before you left the store. So yeah, just to help them navigate things like that. How do you get your IDs? How do you get your, social security card, your driver's license, or a state issued ID? We work with them to get all of those things. But the family advocacy part is something that, we really need to work on, because it's not sunshine and roses for either side when you come out. So we do all of those things. We host 21 different reentry councils across the state, and you're one of them here. But if you want to speak to any of the other ones, my information is at the very top of the chat, and I'll probably email you as well. But we would love to work, to spread resources and information for people that are justice involved, justice impacted, just to help them transition more smoothly. So, but I do all the reentry councils, I do the grant writing, event planning. I'll drop a couple of things over in the chat of events that are coming up. So with that, I'll pass it over to Jeremy.
Hello, I'm Jeremy. I'm the outreach coordinator for the traumatic brain injury program at, excuse me, at WVU. We're a free program that helps fund resources for any individual with a traumatic brain injury. So yeah, looking forward to reaching out, and I can just popcorn. Krisha, is that all right? Wes, that sounds good.
Of course. My name is Wesley Hoffman, and I am new to the state of West Virginia. Just been here about a month, and this is my first meeting. I work in the PROUD, Partners for Reentry Opportunities and Workforce Development. And what we're trying to do is we're trying to create opportunities for folks that are close to getting out, or are in the RRCs, to help them find sustainable jobs through either getting a job directly or through training. So we work with, we are Workforce West Virginia, so we're set up, we have one stops all across the state. My territory is what is referred to as the Northern Region. And there's a gentleman in here by the name of Phil Michael. He's in the room too, and it's our first meeting. And he takes care of the Southern region from Charleston down, and I'll let him introduce himself. I'll pop some information about what we do, a little more detailed, into the chat in just a moment, but I'll hand it off to Phil Michael.
Hi, I'm Phil, and I am working with PROUD with Wes, and we're new to this whole thing. I'm not new to West Virginia, but I am new. What Ms. Robinson was talking about sort of hit home with me. I'm a recently incarcerated individual, and one of my goals is to try and help men and women that are coming out of incarceration to find positions that are good paying positions, and to also help them lead a good life and not have any recidivism. And, if I can do anything to help anybody, or if you can enlighten me, like I said, I've only been on the job now for 2 weeks or 3 weeks now. So Wes and I are willing and able. Just need to get the ball moving on our part. We'll be working with the RRCs and the individuals that are there, and hopefully things go well. Nice to be here.
Oh, Philip, you can pick somebody else to introduce themselves that hasn't gone yet. I know somebody down in the bottom. Wait, where'd she go? I don't know where she's at. Maybe she's not on here anymore. Who else is on here? Oh, we can let Jen introduce herself. She's always got great things to say.
Thank you. Hi, everyone. My name is Jen. I am the outreach coordinator for the Northwood Health Systems Crisis Unit. We are located in the Northern Panhandle. We have 2 crisis units. We have one in Wheeling and one in Weirton, which is Ohio County and Brooke County. We are a dual facility, so we can admit for substance use disorder, detox, and mental health crises. We have the capacity to serve 16 clients at each crisis unit. Our goal is to stabilize their symptoms, make referrals, and connect them to follow-up care. We are a short-term stay, about 5 to 7 days, but we are open 24/7. We currently have beds open for males and females 18 and older. So if you have anyone that's struggling or if you need any help, please let me know and we can get them assessed. And we can also do phone assessments for people that don't live locally. So yeah, my information's in the chat if you have any questions or need any other information. Thank you. And I will pass off to Seth.
Hey, good morning, everybody. My name is Seth Hansen. I'm the Partnership Development Manager for Groups Recover Together. We are an outpatient opioid use disorder treatment program in West Virginia. We have 7 offices across the state. Relevant to this group, I would say Parkersburg, Dunbar, maybe Bartersville, and maybe Clarksburg. We have a 3-tier model following MAT, group therapy, and then what we call care navigation team, which is a group of recovery support specialists helping with those social determinants of health. We do have a couple open houses coming up in September. I'll throw a flyer. Literally just got the flyer this morning. I'll throw that in the chat for you guys as well. So thank you. Let's go to Crystal. Let's go to Tina.
Hello, I'm Tina Ramirez from Marshall Health in Great Rivers, and I pretty much cover the entire spectrum from Charleston South. I help head up several of the quick response teams in the area. So we do work with Jackson County for this area, but we head up Mason, Putnam, and Wayne County quick response teams. I did drop a list of all the recovery events I know that are happening in September. You can take a look at them and just send me an email if there's any that I missed. I know there's a lot more going on that I just haven't seen come across yet. The one thing that I do is if anyone is in the area and interested, Saturday is West Virginia's National Overdose Awareness Day. So that is going to be at the state capitol from 6 to 8. So if anyone's interested in attending that event, it's really a nice way to be there for the families and, you know, those that are still struggling. We're going to have a big butterfly release this year. So if you're interested, just show up that evening on Saturday, 6 to 8.
Crystal, you can go now. I see you back.
Hello, it's Jamie Crystal, Jamie Clay, nurse practitioner. And then Crystal's my office manager. We are located in Ripley, Jackson County. Started off as a MAP program, and now we've expanded to behavioral health. Something I guess probably a little bit pertinent. We're new to this meeting, but we do also see children. So I know a lot of people do not see children. We do see children. We also just recently opened our office in Spencer, West Virginia as well. So glad to be a part of the meeting.
I see Melissa's down there in the bottom.
Good morning. Sorry, my camera is not cooperating this morning, so I apologize for that. But my name is Melissa Morrison. I'm with Jobs and Hope, West Virginia. And I service out of these counties, I service Calhoun, Roane, Mason, and Jackson County. I also have Clay, which is random, I know, but Jobs and Hope helps individuals in recovery and reentry. Our main focus is education and employment. So everyone has to have an education plan and be working towards that in the first 30 to 60 days, which means they have to complete a short-term training or enroll in some type of education training technical program, something like that. And then we help them work towards whatever their career goal is. While they're enrolled and doing those things, we also help with barriers like maybe they have a felony and they need guidance through the expungement process. They may need help reobtaining their driver's license. They may need their educational journey may need to start with obtaining their GED. we can help with all those types of things and other things as well, but that's the main gist of the program.
I don't think Dan has went, unless I made that up, and maybe he did.
No, I haven't went.
Okay. I was like, maybe I'm imagining that, but
No, I'm just kind of hiding here today. My name's Dan Leonard. I'm a peer recovery support specialist at Healthy Minds Clarksburg. I'm also a Jobs and Hope advocate. I work with Shannon Carnes. If any of her clients need peer recovery support, I'm there for her. I also do. I'm also a Reach navigator. I also do smart recovery facilitating. I pretty much, like you said, a jack of all trades. Whatever they want me to do here, I do. Healthy Minds covers a lot of things. We do outreach, there's children and family stuff, mobile crisis team. I do a little bit of everything up here. So if anybody needs any help, my links in the email address in that thing over there. You know what it is. And in worst case, Krisha always knows how to get hold of me. No. Thanks.
Dan the Panda Man.
the jack of all trades, man of my own heart. Did Cynthia go? I don't think she did, but I could be making that up too.
No, I didn't go. Sorry.
Okay,
Let
that's
me,
okay.
I'm Cindy Baker and I work for Prestera in Mason County, and I am the project director for the HRSA grant. And we are currently in our 4th year, actually. The grant was up this year and we've got a no cost extension to extend it for another year. I have a project specialist that works under me who does a lot of the things that that Krisha mentioned earlier, helping people to find to get their birth certificates, their social security cards, so many things like that. And we deal with people only in substance use disorder recovery, and those that are in recovery a lot of times are also ones that have been released from incarceration. So that's what got me interested in this group, is to be a part of it and get as much information as I could. But I know that that we will be here at least another year. What happens after that? Only grant will tell. I mean, what happens after that? But anything I can help with in Mason County, I'll be willing to do. Thank you.
Thanks, Cindy. And last but not least, she might kill me for doing this. My mentor and the facilitator of all my great big old ideas all the time is here visiting us today, Dr. Donna Randolph. So do you want to introduce yourself, Dr. Donna? She's like, no, I don't. Okay, well, Dr. Donna Randolph runs My New Journeys, which is a nonprofit organization, and they do a lot of different things, but a lot of it is, sending cards to people who are incarcerated. She also facilitates with me at SC Justice Group. So I don't know where she went, but she was here. If anybody has any questions, feel free to ask them now. We have a bunch of information in the chat, which I'm sure Krisha will save for us because she's an angel. And we can send you all the follow-up information after this. Okay. Love y'all, mean it. It was great seeing y'all today. I'll give you back a couple minutes of your time. 15 minutes. I did good. Okay. See you next month, same time, same place.
Thanks.
Thank you, Morgan.
Thank you, everybody.
All right. Chastity, I'll get
You.
some. I will send. Do you want one flyer or both flyers?
Give me both of them. Yeah.
And then I'll send you our website also, so you can see what all we do and see how we can work together, you know, I mean, we can.
This child never stops